MIST-1 is the mesothelioma stratified therapy study. This is an arm of an umbrella study which we've developed in the UK. It's an investigator-led study, and the first arm was really a trial of a PARP inhibitor, Rucaparib, in patients with BAP1 or BRCA1 deficient mesothelioma. So this study's been reported now and has met its primary endpoint. We were looking for a greater than 50% disease control rate at 12 weeks. We met that with 58% disease control rate, with a 6-month disease control rate of around about 24%, and durability actually within some patients. So we've had a number of patients now go on beyond a year with stable disease, some having had partial responses. Double figures partial response rate around about 11% as well. Yeah, so I think the significance of this is that these real responses, partial responses that are being seen with a PARP inhibitor suggest an underlying synthetic lethality. This is a phenomenon that we see with the BRCA1, BRCA2 mutations within ovarian cancer. And although only a very small percentage of patients may have mutations in those particular genes, we are seeing not only in mesothelioma but in other cancers a wider range of mutations which can sensitize to PARP inhibitors that involve the homologous repair deficiency pathway. MIST-1 was not the only presentation of a PARP inhibitor this year. We also have a paper from Fennell and colleagues from the US, NIH, and they show responses to olaparib. And finally, another paper abstract presented at ASCO has evidence of homologous repair deficiency in a panel sequenced cohort of about 200 patients, showing that somewhere around about 36–37% of patients have deficiency within the homologous recombination pathway. This is probably one of the more common pathways involved in mesothelioma, and again reinforces the fact that this may be a cancer in which a subgroup of patients do have sensitivity and for whom a PARP inhibitor may be valuable treatment option. We have sequenced patients with mesothelioma within the MIST trial, and are currently trying to understand better exactly what's going on genetically in terms of response rate and genetic correlates.